G'day, Dr. Shane from the Posture Doctor. Today I'm going to talk to you about an orthotic device called the Thoracic Lift. Now the Thoracic Lift is prescribed to patients in my office that have lost the sagittal profile of their posture. And when I talk about the sagittal profile, we're looking at me this way and my posture is straight up and down. The sagittal posture is where the posture shifts backwards and the head goes forwards. So our thoracic spine has come backwards and our head has gone forwards. This is the most common postural problem and is associated with low back pain, middle back pain, headaches, fatigue, lots of aches and pains. So if you've got this posture and you're watching this video, I've prescribed this exercise to you. This is a thoracic lift. It's a foam block which will take your thorax and shift it forward. I will demonstrate that for you in just a moment. When you are using the thoracic lift, we ask you that you start off on 1 minute, and I'll show you how to get on and off the thoracic lift. Because your body has been stuck in a posture where the thorax is going backwards and the head is going forwards, muscles, ligaments and connective tissue have changed. So they're not going to be as flexible coming forwards. The other problem that we may find is certain joints in your spine have developed adhesions, and we call that subluxations, where they don't move. So when we actually try and move the spine forwards, it's going to place a larger amount of stress on those joints, and even as little as 1 minute can make you very, very sore the following day. So we ask that our patients start off on 1 minute. If you are okay with that 1 minute the following day, you don't have any aches and pains in that area of your spine, you'll increase to 2 minutes, and you increase this by 1 minute every single day until you're up to 10 minutes. Now at 10 minutes, the ligaments in your spine that support your spine start to permanently stretch. And this is where we're able to correct the postural problem that we found on your x-ray and in your postural analysis. So I'll demonstrate for you now how to use a thoracic lift. We go down onto the floor. We pull the thoracic lift close to our lower back. We keep the knees bent. We use our arms and we slowly lower our spine onto the thoracic lift. Our arms will go out. Our head will drop back. You can lower the legs down to increase the strain on the low back, and you lay there. Now for patients with neck problems or arthritis in the neck or fixated joints, which we call subluxations, you may need to raise the head up by placing some magazines or books so that the strain on your neck is reduced, and as your body starts to adapt to the stretch and become more flexible, you can remove the books until the head is able to go down to the floor. Now, the correct way is to lay there, breathe in through your nose, out through your mouth, and allow the thoracic lift to move your posture forward. Now, I'm going to show you how to come off it. You bend your knee, you put your hand behind your head, you lift the head with your hand, and you roll your body off to the side, coming up onto your hands and knees. What you don't do is you don't lay on it like so without supporting the spine, and after you've been on it for a period of time, you don't sit yourself straight up. The muscles, ligaments and joints have been stretched, so if you try and come up that way, you're going to end up with possible problems. Once again, coming off, bend the knee, support the head, lift the head up. I'll do it from the other side. Lift the head up, roll the body across. And coming up onto your hands and knees. Now if you've been on there for 10 minutes, you may be a little bit giddy, so just sit there. If you feel okay, come up onto your knee. That is a example of how we use a thoracic lift. Once again, with all these exercises, if you get an increase in your pain or symptoms, stop your exercises until you've consulted with your chiropractor.